You go online. You search for Minoxidil, and what do you find? Terrifying horror stories. People who tried it quit, and then watched gobs of hair fall out. They say it never stopped. They say their hair never returned to normal. In fact, they claim their hair was permanently worse off than before they ever started. Are these stories real? Or is something else happening beneath the surface? I am Dr. Elsie Khalifa. Today we are going to look at the actual clinical evidence, not the anecdotes, not the fear, the science. Because if you are scared to try Minoxidil, or you are using it and terrified to stop, you need the truth. Let us start with what Minoxidil actually is. It is an FDA-approved topical medication for hair growth. You can find 2% and 5% versions over the counter. Prescription strengths go up to 7, 10, even 15%. There are also oral formulations. Minoxidil is a vasodilator. It improves blood flow, nutrient delivery, and oxygen supply to your hair follicles. It also reduces certain inflammatory pathways. What it does not do is target male hormones like DHT. That is finasteride's job. So why do so many people turn to Minoxidil? Because they want to do something for their hair loss without touching their hormones. And the science supports this. Clinical studies show that Minoxidil works for both men and women with pattern hair loss. It works in the short term. It works in the long term. Within 3 to 6 months, users see real cosmetic improvements. But here is the problem. Studies also show that up to 95% of users quit within 1 year. The main reason? Low perceived effect. But I would argue that is actually a lack of education, not a lack of efficacy. People do not understand how Minoxidil works. They do not understand the shedding phase. They do not understand the timeline. So they quit. And then some of them report something terrifying. They say their hair started shedding like crazy. They lost visible density. Their hair loss got worse than before they started. And it never returned to normal. You read these stories and think, why would I ever try this? I understand. But let me show you what the clinical evidence actually says. There is a very well-designed study that tested exactly this scenario. Researchers divided people into 4 groups. One group did nothing. One group used a placebo. One group used 2% Minoxidil daily. One group used 5% Minoxidil daily. The study ran for over 100 weeks. For most of that time, the Minoxidil group saw significant hair growth. But then, at week 96, the researchers did something unexpected. They secretly switched the Minoxidil users to placebo. The users had no idea what happened next. Their hair took a nosedive. 3 months after quitting, their hair counts were actually worse than the people who never started treatment at all. But then, over the next 3 months, something changed. Their hair counts started to recover. 6 months after quitting, they were no longer statistically different from the untreated group. They had returned to where they would have been had they never started Minoxidil in the first place. So the horror stories are not exactly wrong. There is a shed. It can be dramatic. But the science says you recover. However, there is a nuance. If you look closely at the data, the group that quit never quite reached the exact same hair count as the untreated group. They were slightly lower. Not statistically significant, but slightly lower. So which is it? Do you fully recover, or are you permanently just a little worse off? There are 2 competing theories. The first says that if the study had run just 6 to 12 weeks longer, the groups would have converged perfectly. The trend lines were heading in that direction. Statistically, there was no significant difference at the end. So it is reasonable to believe you will fully recover. The second theory says the opposite. It argues that when you quit Minoxidil, you trigger something called a treatment withdrawal Telogen Effluvium. That is a massive shedding event. As those hairs regrow, they come back slightly more miniaturized than before because of the natural progression of androgenetic alopecia. So you are left with thinner hairs, less volume, and a permanently lower hair count. Not by much, but by some. Which theory is right? Let me bring in evidence from 4 studies on genetically identical twins. These studies looked at why one twin goes bald faster than the other. The answer? Lifestyle. The twin who drank more, smoked more, had more stress, went through more divorces, had diabetes, metabolic syndrome, all of those factors accelerated their hair loss. And interestingly, all of those factors are associated with telogen effluvium, excessive hair cycling. So this suggests that accelerated hair shedding can accelerate balding. If that is true, then a Minoxidil withdrawal shed could also accelerate balding. But here is the key question. By how much? The same twin study gives us the answer. At the end of life, Despite decades of different lifestyles, 92% of twins had basically the same looking head of hair. Only 8% showed slight cosmetic differences. So over an entire lifetime, even with repeated shedding events, the difference was tiny. Now reflect that back on minoxidil. One withdrawal event? The magnitude of impact is likely inconsequential. In my opinion, if the study had been extended, we would have seen full convergence. You will return to where you would have been had you never started treatment. Could there be a tiny, almost imperceptible difference? Possibly, 0.5%, 1%. But the totality of evidence suggests that this risk, while real, is very, very small. There is one more fascinating finding. A separate study looked at people who used microneedling with topical minoxidil. When they quit, the staying power of their hair gains lasted much longer than those who used minoxidil alone. That is worth exploring. So here is my takeaway. The minoxidil horror stories are not lies. Those people experienced a real shed. It was scary. It was dramatic. But the science suggests that over time, their hair recovered. If it did not fully recover, the difference was so tiny it barely registers. You should not let these stories scare you away from an effective treatment. And if you are already using minoxidil, do not let fear of stopping trap you. You have options. You have knowledge. And now you have the data. I am Dr. Elsie Khalifa. If you learned something today, hit like and subscribe for more unfiltered medical truth. Share this with someone who is terrified to start or stop minoxidil. They need to see this. See you in the next video.